The government insists it's been working for months on a plan to expand access and reduce wait times for Kiwis desperate for potentially life-saving diagnostic screening. Today, Health Minister Simeon Brown made a surprise announcement that he'd found $65 million to fund additional procedures, including colonoscopies. It comes after a Paddy Gower Has Issues investigation reported a growing number of young people are getting bowel cancer amid delays in being diagnosed. Adam Hollingworth reports.
If it's caught early, cancer doesn't have to be a death sentence. And the Health Minister acknowledges delays in diagnoses are causing anxiety, holding up treatment and adding pressure on our hospitals.
Around 40,000 New Zealanders are waiting too long for critical diagnostic scans such as MRIs, CTs, colonoscopies, echocardiograms and colposcopies.
$65 million has been sourced from efficiencies, savings on contracts with the private sector, and a funding pool set aside to address emerging health needs.
Patients can get answers sooner, doctors can diagnose problems earlier, and treatment can begin quicker without delay. And for many New Zealanders, this is going to be life-changing.
Bowel Cancer New Zealand CEO Peter Huskinson says it's a step towards fulfilling an election promise to lower the bowel cancer screening age to 45.
Yeah, I'd like to do that.
But what we hope is that they're pulling out all the stops to try and meet the pledge that they made back in 2023, and certainly this would be a welcome step towards that.
Health union Apex welcomes the move after a recent report found significant failings in public radiology services, outdated machines, shortages of equipment and an exhausted workforce.
This is about putting patients first, faster access, faster answers and faster treatment.
We need a cancer treatment plan that has to start today.
Blair Vining died of bowel cancer in 2019. His widow Melissa says more colonoscopies are only part of the solution.
Right now, in likes of Southland and Otago, the wait lists are exceeding clinically safe timeframes for symptomatic and surveillance patients because there is physically not enough surgeons in the region. So whilst they say we're going to give you money, you've got to actually physically have the specialists to do the work.
The Health Ministry won't be drawn on how long queues are because it says it's a complex issue, depending on how sick patients are. But it's safe to say this money will help to reduce wait times to 42 days or fewer.
You know, this is going to uplift all of those wait times.
Don't it fun, Paddy? We're over halfway around now.
Just 2 days ago, Paddy Gower Has Issues highlighted bowel cancer and the growing number of young people who are contracting the disease.
Is it because of Paddy Gower's got issues?
No, this has been something that's been worked on for some time.
A few months certainly in the making, trying to make sure that we do this in a way that delivers the most for all New Zealanders. And we built this as an integrated program, building capacity within our system at the same time as delivering increased diagnostic tests.
The ministry says the extra time it spent was on building the system and workforce to deliver those extra diagnoses.
This has been a plan that's been in the making for many months, and in fact, if you were to talk to our radiology clinical network, they'll say they've been waiting for this and really keen to get this moving for probably a year.
The minister's promising more announcements soon on widening eligibility for screening and making fit tests or poop tests available to anyone with symptoms.